refractive surgery, these are a group of different types of eye surgeries by which we remove the spectacle number of the patient and give the patient spectacle freedom. Now, these surgeries can either be done on the surface of the eye, or sometimes we may be doing it inside the eye. So it's an umbrella basically. So depending upon the age and the number of the patient, and of course some other finer configurations of the eye, we decide as to which type of surgery is required to make this particular patient spectacle free. Now very often we get young adults who have numbers say around 2, 1.5 right up to around 6 diopters. In these patients, I strongly suggest a surface procedure like a LASIK. Why LASIK? Because it's a well-tried, tested procedure and there is no downtime in it, provided, as I said, that the eye is suitable for it. Contoura by itself is one of the best things that happened to refractive surgery. And it's a kind of a software which we apply, wherein, very simply put, so when we work on the cornea is like a watch glass and we want to make it very smooth. Now, it does not really become, by most of the procedures, it does not become very smooth. Now, the cornea has a lot, you see these knuckles. Now, it has these many places, it has some troughs and some crests. So what does contoura do? It picks up all these aberrations or these odd shapes and it smoothens and flattens it out. And then you get a pristine tissue or a cornea which is able to refract light thoroughly, giving you clarity of vision. And it also marks almost 20,000 points on the cornea. So it marks 20,000 points of the cornea and then it's working on them, it's cleaning them up, it's shaping them up. So obviously at the end of it, the kind of vision that the patient gets is like a high definition vision, we can call it, and clarity. And it's known that after contoura, a patient gets almost 15% better vision as compared to any other regular refractive surgery. Contoura LASIK can be done on anyone, provided their powers are stable. So we say 18 years is the cutoff age. Cutoff age because we think that, okay, after 18, the boy or the girl has got their maximum height and the globe has grown maximally and the numbers will not fluctuate. That's just an arbitrary number. What we really want is a stable refraction. So if a patient has had a stable refraction for a year and a half or 2 and it has not changed, then we think this is a good person to go in for a refractive surgery. So 18 to any age. So the oldest patient in whom I have done LASIK is 63 years old. Refractive surgeries, as I said, there are certain surface procedures. Surface procedure is like a LASIK where a flap is raised and the laser light is shot and then the flap is reposited. This is a LASIK. Then we do something called as a trans-PRK or a stream light, in which is a bladeless, touchless, flapless surgery. Then there are other procedures which are femtolasic procedures which we do, wherein we may be doing something like a smile, where through a very small opening, a disc is made, cut out in the tissues of the cornea, and then this is extracted out. Then there is something called as silk. So there are many different procedures which are surface procedures, as I said. And with this, we deal different types, a little thin cornea or a little bit higher numbers. All this can be done. But in my practice, I strictly don't like to do a LASIK or a surface procedure beyond 6-7 diopters. Then I look at something else. The next kind of a refractive procedure which I like to do is implanting a lens inside the eye, which is like a contact lens being fitted inside the eye, but it's a more permanent contact lens. So we call it the ICL procedure. We have some imported lenses, we have Indian lenses which are very, very good to be used for this procedure. And this gives again a very crisp vision to the patient, and it's a reversible process yet a permanent process. When we put in an ICL, unlike a contact lens which has to be fixed in every day and removed every day in the night before going to sleep, in this the lens is sitting perfectly well inside the eye, and the patient can just keep it for as many years as the patient wants. So that's the beauty of the procedure, that it's permanent and at the same time very reversible. So at any stage, if the patient were to develop a cataract or there is some complication that develops later in life, we can always correct it off. So in ICL procedure, the crystalline lens is retained and an additional lens is implanted. So it's just like your contact lens, instead of sitting on top of the eye, now it is sitting inside the eye. So we're really not disrupting anything and we are not removing anything from the eye, we are just adding on. In a cataract surgery or refractive lens exchange, we are removing the crystalline lens and we are replacing that lens with a man-made implant or a man-made intraocular lens. That is the difference between ICL and refractive lens exchange or cataract. Sometimes we get patients in the age group of say 45 years or 50 who want to enjoy spectacle freedom. Now these patients are not very ideal for doing LASIK, because even if I do a LASIK at 50-year-old, what happens is that they get good vision for far, but intermediate and near is still compromised, because your near vision glasses are going to keep coming in, the powers keep coming in till the person turns 60. So a better thing to do for them is to offer them a refractive lens exchange, wherein we exchange God's lens, the crystal which we have in the eye, with a man-made lens. And this of course we can tailor make it to clear the patient's distance vision, intermediate and near vision, and at the same time, as I said, this can be a very, very permanent procedure. It can last the whole life till the last breathing second of the patient. So yes, that is a very, very attractive procedure and many, many people do take it up. Many young adults, I have actors, painters and sports persons who've gone in for this procedure and they're happy with it. Any refractive surgery done in the right eye and the right procedure in the right eye, I will say, will not have any harmful effects. Initially, in the first 1 month of the post-op care, thereafter it's all forgotten and life goes on normally.